دار السلام Cancer Hospital, Senior BMC Clinical Pharmacist at Egypt Air Hospital. So, Dr. Mai, if you can start,
Okay.
you are ready?
Yes, I'm ready. Hello, all of you dear
Dr.
participants.
Mai, can you hear me?
Uh, yes, I hear you. Can you hear me? Am I audible?
Definitely.
Dr.
Thank
Mai,
you.
Okay. Hello, all of you dear participants. Peace be upon you all. It's my pleasure to participate in such a great, outstanding training program. Thank you all for being here today, and I'd like to extend my thanks to dear Professor Mahmoud Hamad for giving me this opportunity. Let's start our topic today. Role of pharmacists in sterile compounding and the safe handling of hazardous drugs. Today we will go through an overview about sterile compounding and aseptic technique. We will see together the sterile compounding environment in details. We will talk about the hazardous drugs and the occupational exposure to these drugs and its negative impact and consequences. We will discuss the recommendations that must be implemented in order to decrease the risk of occupational exposure to hazardous drugs. And I will end up by highlighting pharmacist role in IV admixture unit and in handling hazardous drugs, and also will highlight pharmacist impact in this setting. So let's start from the beginning. First of all, what is sterile compounding? Sterile compounding is the method of preparing custom medication for patients in a sterile environment in order to prevent contamination and ensure patient safety. It involves combining, admixing, diluting, reconstituting, repackaging, or otherwise altering a drug substance to create a sterile medication using aseptic technique. What I meant by aseptic technique? It is the technique and procedures that designed to prevent contamination of a preparation by microorganisms during sterile preparation. The failure to follow the protocol of aseptic technique may lead to microbial contamination of the medication and so resulting in serious infection to the patients that may affect their morbidity and mortality. Especially our patients, cancer patients, they are prone to catch infection very easily because they are immunocompromised, either due to the presence of the cancer itself or due to the effect of treatment by the chemotherapeutic agents. So we must be very cautious and meticulous with these patients. Let's go deeper and talk about the sterile compounding environment. The sterile compounding area include a well-lit buffer area and ante-room. Both are called secondary engineering controls, and it also contain an area for storage of sterile products and supplies. A specialized HVAC system, clean room constructed of non-porous materials, and strictly regulated air pressure and humidity control all serve to create appropriate ante-room and clean room environments that are low in particulate matter. It's important to know that United States Pharmacopoeia Chapter 797, which is titled Pharmaceutical Compounding and Sterile Preparation, establish standards and provide guidelines for any healthcare facility engaged in the compounding of sterile preparation. It outlines all the necessary requirements and procedures for preparing compounded sterile preparation in details. Let's give an overview about the ante-room setup and characteristics. The ante-room, which is also called transition area or ante-area, provide a space where compounding personnel can perform aseptic hand washing, garbing, and product decontamination. It serves as a transition area that provides assurance that pressure relationships are constantly maintained so that air flow from clean to less clean area. It also serves as a way to further segregate the clean room from other less clean areas of the facility. As we can see together, this is an example of an ante-room that contains sink for hand washing and adequate space for garbing and product decontamination. The clean room setup and characteristics. The clean room is the innermost room. It is also called buffer area or IV room. The clean room is defined as an area where primary engineering control is located and where activities such as preparation, compounding, and staging of compounded sterile preparation occur. The access to the clean room must be restricted to properly trained and garbed personnel. The surfaces of the clean room must be smooth, non-porous, and easy to clean. And it's important not to locate computers, printers, or other devices in the clean room, just only bring those supplies needed. Within each primary engineering control, the area closest to the hood's HEPA filter is called the direct compounding area, or the first air. The sterile compounding procedure are performed in this direct compounding area. In order to avoid disrupting the airflow from the HEPA filter, personnel working in the hood should minimize their movement as much as they can. It's important to know that the buffer area for compounding non-hazardous sterile products must be positive pressure in order to prevent the external air from entering into the clean room, while the buffer area for compounding hazard products must be negative pressure in order to contain the hazardous drug and decrease the risk of exposure. This is an example of a clean room that contains two primary engineering controls. When we talk about the sterile compounding environment, we must mention the ISO classification. The ISO air clearance classification of the compounding environment is a critical measure that is affected by facility design. United States Pharmacopoeia Chapter 797 identifies several ISO classes that classify the amount of particulate matter in room air. As we can see together, the classification numbered from class 1 to class 9. The higher the number, the greater the allowance for particulate matter. So ISO class 1 is the most clean one and ISO class 9 is the least clean one. This can be achieved and controlled by HEPA filtration, air locks, and the number of air changes per hour. The particulate matter in the pharmacy anteroom must meet ISO class 8 standards if it open to positive pressure buffer area, while if it open to negative pressure buffer area, it must meet ISO class 7 standards. At the next level of stringency, the particulate matter in the clean room must meet ISO class 7 standards. Stricter still, the air within the direct compounding area of a hood must meet ISO class 5 standards. Now let's talk briefly about the different types of primary engineering controls. There are 4 types of hoods that can be used: compounding aseptic isolator, compounding aseptic containment isolator, biological safety cabinet, and laminar airflow workbench. Let's see what is the difference between them. Compounding aseptic isolator and compounding aseptic containment isolator. They are also called barrier isolator or isolator cabinet. Most useful in a sterile compounding environment where relatively few preparations are made each day. Personnel place their hands inside the gloves and reach through the inner pass-through window. As we can see together, there is a total physical separation between the product and the environment. It is a completely closed system, and that's why it is called an isolator. There is an antechamber. Prior to each compounding run, the personnel bring only the items required for the compounding process into the cabinet and make sure that the interior door of the antechamber is closed before introducing any material into it. It's important to know that when handling non-hazardous material, a compounding aseptic isolator is used due to its positive pressure nature, while when handling hazardous material, a compounding aseptic containment isolator is used due to its negative pressure nature. And it's important to clarify that one of the main advantages of CAI and CACI that it is not mandatory to place them in ISO class 7 environment. The third type of hood is the laminar airflow workbench. Laminar airflow cabinets are designed to prevent product contamination. This is achieved by a constant airflow moving at a uniform speed in one direction in order to create a clean work environment. It's important to note that they don't provide any protection for the lab workers or the environment, so not be used in the preparation of hazardous medications. There are 2 types of laminar airflow workbench, vertical and horizontal, which reflect the direction of the airflow within the hood. The air from the surrounding environment is pulled by a blower and released into the working area through a HEPA filter. In the workbench, most of the air moves toward the operator and then back into the environment, so it doesn't provide any protection to the operator and the environment. In the vertical laminar airflow workbench, the air moves from the top of the cabinet toward the workbench, while in the horizontal one, the air moves from the behind of the cabinet toward the operator, and both of them have positive pressure in order to prevent the external air from entering into the cabinet. The fourth type of hood is the biological safety cabinet. The biological safety cabinet is a special hood for preparing hazardous medications as chemotherapy. It provides personnel and environmental protection and usually product protection. The worker stands behind the shield and places his hand into the cabinet to manipulate the sterile preparation. There are three classes of biological safety cabinet, class 1, 2, and 3. Class 1 biological safety cabinet is a ventilated cabinet which provides personnel and environmental protection only. It has a negative pressure, so protect workers, HEPA filter at the exhaust, so protect the environment, but no HEPA filter for the airflow inside the hood, so no product protection and so used only for non-sterile preparations. While Class 2 biological safety cabinet provide personnel, product, and environmental protection. It has a negative pressure, so protect workers, HEPA filter at the exhaust, so protect the environment, and HEPA filter for the airflow inside the hood, so protect the product and used for sterile preparations. Class 2 biological safety cabinet consists of 4 types according to the airflow pattern and the airflow velocity. Class 2 Type A1, Type A2, Type B1, and Type B2. Type A1, 70% of the air recirculated to the cabinet work area through HEPA filter, and only 30% can be exhausted through HEPA filter back into the room or to outside through a canopy unit. Its airflow velocity is 75 feet per minute. Type A2 is similar to A1 except only in the airflow velocity, which is 100 feet per minute. Type B1, 30% of the air recirculated to the cabinet work area through HEPA filter and 70% exhausted. While Type B2 is the perfect one, no air recirculation, it has a total exhaust to outside through a HEPA filter. Going to Class 3 biological safety cabinet, it provides personnel, product, and environmental protection. They are also called glove boxes. They are hermetically sealed and all procedures are conducted through arm-length rubber gloves. Class 3 biological safety cabinet usually used in high-level containment labs. To summarize the previous part of the lecture, this is the sterile compounding environment. It consists of anteroom with a positive pressure and buffer room for non-hazardous drug preparation with positive pressure, and its positive pressure gradient is more than the anteroom in order to prevent the external air from entering into the clean room. And there is also another buffer room for hazardous drug preparation with a negative pressure in order to contain the hazardous medication and decrease the risk of exposure. Regarding the ISO classification, the anteroom must meet ISO class 7 standards, and it is acceptable to meet ISO class 8 standard if it open to positive pressure buffer room only. The buffer room must meet ISO class 7 standard, and the primary engineering control must meet ISO class 5 standards. Regarding the primary engineering control, a laminar airflow workbench or compounding aseptic isolator can be used for compounding non-hazardous medications, while biological safety cabinet class 2 or 3 or compounding aseptic containment isolators can be used for preparing hazardous medications. From the beginning of the lecture, I say hazardous, hazardous. What I meant by a hazardous drug and when can we define a drug as a hazardous? The National Institute for Occupational Safety and Health define drugs as a hazardous if they meet one or more of the following criteria in humans, animal models, or in vitro system: carcinogenicity, teratogenicity or other developmental toxicity, reproductive toxicity, organ toxicity at low doses, genotoxicity, and any other drug similar in structure or toxicity to drugs classified as hazardous. The NIOSH list of hazardous drugs is divided into 3 tables. Table 1 consists of the antineoplastic drugs, Table 2 consists of the non-antineoplastic hazardous drugs, and Table 3 consists of the non-antineoplastic drugs with primarily reproductive toxicity. The Occupational Safety and Health Administration and National Institute for Occupational Safety and Health identified worker exposure to hazardous drugs as a problem of increasing health concern. Preparation, administration, manufacturing, and disposal of hazardous medication may expose hundreds of thousands of workers to potentially significant levels of these chemicals. So, what are the hazards that may occur due to the occupational exposure to hazardous medication? The occupational exposure to hazardous drugs may lead to either acute effects or chronic effects. Acute effects such as nausea and vomiting, skin rash, hair loss, headache, and hematological toxicity, and chronic effects such as organ damage, developmental or reproductive toxicity, genotoxicity, and even cancer. Let's talk about the types of exposure to hazardous drugs. The types of exposure to hazardous drugs may occur through dermal and mucosal absorption, inhalation, ingestion through contaminated foodstuffs, spills or mouth contact with contaminated hand, and it also may occur through accidental injection. Now, it should be clear that there are three basic principles when handling sterile hazardous medications: protection of the patient, protection of the environment, and protection of the personnel. Let's talk about the recommendations that must be implemented in order to decrease the risk of occupational exposure to hazardous medications. United States Pharmacopoeia Chapter 800 provides standards for the safe handling of hazardous medication, from the transport and the storage to the preparation and administration, and this in order to decrease the risk of exposure to healthcare providers, patients, and the environment. The first recommendation is regarding the environment. Facilities must identify all areas where hazardous drugs are stored or handled. Hazardous drugs should be handled in restricted area where access is limited to authorized personnel trained in handling requirements. Regarding the compounding, only individuals trained in the compounding of hazardous medication should do so. Hazardous drugs should be compounded in a controlled area where access is limited to authorized personnel trained in handling requirements. And as mentioned before, sterile and non-sterile hazardous drugs must be compounded in environments that have a negative pressure to all adjacent areas. Regarding the administration, only nurses trained in the administration of hazardous medication should do so. During administration, the access to the administration area should be limited to patients receiving therapy and essential personnel only. The second recommendation is regarding the ventilated engineering control. Engineering controls protect workers by removing hazardous conditions or by placing a barrier between the worker and the hazard. As mentioned before, biological safety cabinet class 2 or 3 or compounding aseptic containment isolators can be used for preparing sterile hazardous medications. And regarding the ISO classification, the air inside the primary engineering control must meet ISO class 5 standards, and the ante-room and buffer room for preparing sterile hazardous medications must meet ISO class 7 standards. The third recommendation is the personal protective equipments: gloves, gowns, head covers, face masks, eye goggles. Appropriate PPE must be worn when handling hazardous drugs during receipt, storage, transport, compounding, administration, decontamination, cleaning, and disinfection, and also during spill control and waste disposal. The fourth recommendation is the personnel training. All personnel who handle hazardous drugs must be trained based on their job functions. Training must occur before the employee independently handle these drugs. As well, personnel competency must be reassessed at least every 12 months, and all training and competency assessment must be documented. The training must include at least the following: overview of the entity's list of hazardous drugs and their risks, review of the entity's standard operating procedures related to handling of hazardous drugs, the proper use of PPE, the proper use of equipments and devices, the response to known or suspected hazardous drug exposure, spill management, and the proper disposal of hazardous medication and trace contaminated material. The fifth recommendation is the documentation and standard operating procedures. The entity must maintain SOPs for the safe handling of hazardous drugs for all situations in which these drugs are used throughout the facility. The SOPs must be reviewed at least every 12 months by the designated person. The facility must establish SOPs for all the following: labeling, packaging, transport, and disposal of hazardous drugs, spill management and the use of a spill kit, designation of hazardous drug area, storage of hazardous drug, compounding of hazardous drugs, the use and maintenance of engineering control, hand hygiene and the use of PPE, deactivation, decontamination, cleaning, and disinfection. The last recommendation is the safety program. The facility must establish policies and procedures that ensure worker safety during all aspects of hazardous drug handling. Facilities must have safety data sheet for each hazardous chemical they use. These safety data sheets must be readily accessible and available to all personnel during each work shift and when they are in their work areas. As well, personnel of reproductive capability must confirm in writing that they understand the risk of these drugs clearly. Let's talk about the pharmacist role in IV admixture unit. Pharmacists working in IV admixture unit and handling hazardous preparation play a critical role in ensuring the safety, efficacy, and the quality of medication administered to patients. Their responsibilities in these settings are complex and vital to patient care, involving not just only dispensing medication, but also overseeing the safety of preparation, storage, and delivery processes. The first responsibility of pharmacy is the preparation and compounding of IV medication. Pharmacists must ensure that IV medication are compounded accurately according to established protocols, including dose verification, correct reconstitution of vials, correct dilution. They must check the compatibility, as pharmacist education should prepare them to deal with problems of physical, chemical, and therapeutic incompatibilities and to design suitable alternatives when these problems arise. They must also check the stability, as drug stability information must be readily accessible to the pharmacist in order to determine optimum conditions for drug storage prior and after preparation. Pharmacists must also ensure that all medications are prepared in an aseptic environment to minimize the risk of contamination. The second role of pharmacists is to ensure medication safety and efficacy, and this is through ensure medication appropriateness, dose verification, check the need for any dose adjustment, verify the administration route, check the presence of any drug interaction, calculate the infusion rate, and ensure proper labeling in order to prevent medication errors. Pharmacists are also responsible for patient counseling and education. They play a key role in educating healthcare providers and patients about IV medications, including the administration process, possible side effects, and proper storage. This ensures that patients and clinical staff understand how to handle these medications safely. Pharmacists also provide information on alternatives for patients who are allergic or have contraindication to certain IV medications. Monitoring and quality assurance is one of the responsibility of pharmacists in IV admixture unit. Ongoing monitoring of drug preparation and delivery processes is a critical responsibility. Pharmacists are involved in routine checks of medication and equipment to ensure proper sterilization, expiration dates, and maintenance of equipment. This monitoring significantly reduces medication error in IV compounding. One of the most important roles of pharmacists in IV admixture unit is to establish policies and procedures. Guidelines for preparing parenteral products should be outlined in the pharmacist policy and procedure manual. Detailed information regarding preparation, stability, compatibility, labeling, storage, and expiration date of parenteral products should be readily available in the pharmacy. As well, policies and procedures for aseptic technique should be readily available and accessible in the pharmacy. Moving to pharmacist role in handling hazardous drugs, pharmacists must ensure the safe handling and preparation of hazardous medication. Pharmacists working with hazardous drug must adhere to strict guidelines to avoid exposure, as the use of PPE, as well as working within specialized containment devices. Proper training of the pharmacy staff in safety protocols of handling hazardous drugs is crucial and mandatory in order to reduce the risk of occupational exposure. Pharmacists are responsible for preparing hazardous medication according to the standards set in the United States Pharmacopoeia Chapter 800, as mentioned before. They must also ensure that the drugs are clearly labeled with proper warning regarding their hazardous nature and ensures that the correct administration route and patient-specific doses are followed. Pharmacists also play a key role in the environmental and staff protection. One of the most critical roles of pharmacists in handling hazardous drugs is to ensure that the working environment is adequately protected. This includes maintaining airflow and air quality control system and regularly monitoring the effectiveness of containment equipments. They must also implement policies for the safe handling, storage, and disposal of hazardous medications. Pharmacists are also responsible for training and education, either staff training through providing education and training for pharmacy staff and other healthcare professionals on safe handling practices and emergency procedures related to hazardous medication, as will patient education through educating patients about the risk associated with hazardous medication and the importance of adherence to safety protocols. Going to the last part of our lecture is the impact of pharmacists in IV admixture unit and in handling hazardous medications. It goes without saying that pharmacists play a significant role in the reduction of medication errors. Research has shown that pharmacist involvement in verifying drug dosage, dilution, and compatibility in IV preparation significantly lower the incidence of errors and adverse drug reactions. Pharmacists also play a key role in the enhancement of patient safety, as pharmacist oversight ensures that patients receive the correct medication at the correct dose and through the correct route. As will in chemotherapy setting, pharmacists are instrumental in ensuring that the drug is properly compounding and minimizing risk related to chemotherapy-induced complications. Pharmacists also play a significant role in the improvement of occupational safety, as pharmacists lead initiatives to handle hazardous drugs safely, reduce both direct exposure to healthcare staff and the risk of drug contamination in the workplace. This reduces adverse health outcomes for staff and improve overall workplace safety. And it goes without saying that one of the most important impacts of pharmacists in IV admixture unit and in handling hazardous drug is cost saving. Preparation in the IV admixture unit is more economically than individual nurses on a patient unit. The overall cost of drug diluent procurement, preparation time and waste is less in pharmacy-based admixture program and in sharing strategy. In pharmacy, frequently administered medication can be obtained in bulk containers, which decrease drug procurement cost, and also can be prepared in batches, which decrease both labor and waste. Thanks a lot, all of you, for your attendance.
Thank you, Dr. Mai, for your nice presentation. The floor is open now for any questions. If you have any question, you can write it in the chat box or raise your hand. So Dr. Kwaki Bakri is having a question. The floor is open to you. You can ask.
Hello.
Yes, hello.
Yes, thank you so much for the nice presentation. This is awesome. And I would like to ask you, because in the Constitution, we have biologics drugs. I don't know, as I have seen some practice in some areas, like in my country, Tanzania, when people started reconstituting the biologics drug, they're not using any maybe biosafety cabinet or laminar flow sector, they reconstitute it outside it. So I don't know the practice. Could you share the experience from presenter or other participant? Is that the best way on how to reconstitute biologics like rituximab, bevacizumab, etc.? Another question is on the maybe in dispensing of antineoplastic tablet or capsules like capecitabine and others. There is some contradictions. For myself, in my practice, I think this is the same as what we reconstruct. We need to make some protection, the flu protection, because sometimes you can have some maybe spillage. Sometimes maybe this medication, sometimes they are very volatile. And I emphasize if you want to dispense maybe you take some tablet from the tin which you have to dispense to other patient, and the tin should be returned back to the pharmacy. I think it was better also to make this dispensing inside the biosafety cabinet. Is that correct practice? Thank you.
Thank you for your question. The first one, every hospital and facility must check the NIOSH list regarding all the medications they use. Regarding the target therapy and the monoclonal antibodies, you must check them in the NIOSH list if these drugs are hazardous or not. The second question is regarding the tablets, dispensing of the tablets. Of course, tablets, chemotherapy tablets should be dispensed as a bulk container. It's not acceptable to dispense only half of the container to a patient. No, the bulk container must be dispensed to the patient.
Mm. Mm. Okay.
Dr. Jennifer, you have a question?
Thank you. Hi, it's Jennifer Giel in South Africa. It was a really lovely talk. Thank you. I'm a pediatric oncologist, not a pharmacist, so I learned a lot. My question is, if you don't have access to these really nice biohazard cabinets and all that space, are there any accepted guidelines or any ideas on what you can do? So as an example, in our unit, we mix chemo for probably about 40 patients a day. And it's really just a room. There's no anteroom, there's no clean space. There is a tap, for washing hands and things. There is a biohazard cabinet. But that's it. And I know in other places they have even less. I've heard of some people mixing chemo just in the ward. So are there any alternatives to increase safety for people mixing chemo? Thanks.
Your facility doesn't contain biological safety cabinet or CAI or CACI?
It has a biohazard cabinet with laminar flow. That's it. That's all I know about it.
Okay. The proper use of PPE is the perfect way to protect the workers. Nothing can be done yet.
So you're saying the most important thing is to just wear PPE?
Exactly.
Okay. All right. Thank you.
Thank you.
Dr. Mai, Dr. Purity is asking if you can talk in the spell management of hazardous drugs.
Okay. It's a
Hello.
Hello, Dr. Mai. You,
Am I
uh,
audible?
No, your sound was disappeared. So can you repeat?
Okay.
Okay.
Can I ask again?
The question is about the
We,
spill control.
yes, spill management of hazardous drugs.
Okay, every facility must contain spill kit containing all the materials needed to clean any spills occur. This is the key for the spill control.
Okay, so Dr. Emmanuel is asking about the role of other multidisciplinary team member in the handling of hazardous drugs. Dr. Mai, are you hearing
Okay.
me?
Yeah,
Okay.
yeah. Role of other multi.
Dr. Mai, we are not hearing you. Dr. Mai, can you hear me? If you are talking, we are not hearing you.
Maybe she can left and join again. Maybe it could be of the challenge of network. Oh,
Yes, she's trying, but we are having some network problems here in Egypt because we are having some weather problems.
Can you hear me?
Yes, can hear you now.
Okay, sorry.
No
The
problem.
question is the role of other multidisciplinary team member in the handling of hazardous drugs. Of
Yes.
course, all the multidisciplinary team play a key role in handling or on the safe handling of hazardous drugs. Physicians, as physicians determine clinical indication for hazardous drug use, discuss risk and benefit with the patients. Nurses also monitor patient for adverse effect and educate patient about the risk of these drugs. Also, in some facilities, nurses are responsible for the preparation of and compounding of hazardous drugs, but under the supervision of clinical pharmacists or pharmacists.
Okay, thank you, Dr. May. I think Dr. Kwaki was having another question.
yes. For myself, in my side, I want from Dr. Mai experiencing on how to handle. Maybe there is a guidelines on how to handle leftovers, because after the constitution, we have been maybe trained on how to handle maybe leftover ampoules, vials, and sometimes those maybe from the ward after being administration. So those maybe infusion bags, giving set, or preparations in preparation room, we have this PPE, etc. So all of these things should be maybe handled with care. But after that, in most of the practice, they can be taken by general care personnel who do cleaning, etc., for housekeeping. But until now, we have the big challenge on how we could distract this maybe leftover in order to protect the environment, but also medical practitioners and other staffs in the maybe in the hospital. I don't know at your side in your hospital, or if there is any guidelines on how to guide hospitals and the other regulatory authorities so that to handle this maybe leftovers, the same as expired medications of hazardous medicines.
Sorry, please repeat the question. I don't hear it. I have a internet issue. I'm sorry.
Yes, my question is on the by sharing your experience on how we handle these leftovers from the reconstitution, including vials or ampoules, after being maybe reconstituting the medications. So where there is any guidelines or based on your practice, how the hospitals have to go after reconstitution, after administration, from ward, from pharmacy, etc., so that we can protect the environment, but at the same time we can protecting our client and even the maybe medical practitioners who are on the hospital environment, because in some cases they have seen that they guide us to dilute them within the maybe sometimes in spirit, in alcohol based 70% to maybe to detoxify them, or to maybe to denature the chemical leftovers, chemotherapy leftovers. But I don't know how we really practice on how we can protect the environment, because most of these leftovers from the reconstitutions, they are being taken by the housekeeping personnels, and maybe sometimes they're being disposed as a general waste. So I don't know if you have that experience on how to handle these cases, or there is any guidelines, maybe ISOP guidelines, or maybe from CDC, etc.
Regarding the reconstituting vials or ampoules, the pharmacy must establish a policy for the beyond use date of these medications. And regarding the disposal of hazardous drugs, also the pharmacy must establish policy for this disposal. These policies can be checked in the United States Pharmacopoeia Chapter 800 and Chapter 797. It contains all the details about this.
Thank you so much.
Thank you.
Thank you so much. Chapter 7?
797 and Chapter 800.
Okay. I have to write somewhere because I have to share this information with my mentees also.
Okay.
Yep.
Dr. May, there is a question in the chat box about asking about sharing the slides of the lecture.
Of course, yes. I will share it.
Okay, thank you.
Thank you.
Thank you, Dr. May. Does anyone has any question again?
I'd love to just ask Dr. Mai a question once everybody is
Okay,
gone.
thank you, Dr. May, for
So
this
I'll just wait.
informative lecture. We hope to see.
Hello.
Sorry, Dr. Jenna.
Hello. Hello,
Hello.
doctor.
Hello.
Hello. Sorry, I couldn't raise my hand, but this is Fausto Calderon from Central America. I'm a pharmacist, and thank you very much for your presentation. I have learned very much, and I have a quick question. Talking about the biosafety cabinet, does the type 2 cabinets have the same protection for the operator? Do you have that information? Because
You ask
we have
about the
one.
difference you ask about the difference between type 2 biological safety cabinet type 2 classes?
Yeah, type 2 classes,
The-
type A2 and B2,
Okay.
because I don't know if they have a different kind or type of or level of security for the operator, or are all the same.
Okay. لا. As mentioned, the perfect one is type P2 because it has a total exhaust to outside, no air recirculation. So type B2 is the perfect one.
All right, and between among the type 2 class cabinets,
Type
uh,
P2 is the most safer for hazardous drug preparation.
all right, but it doesn't. It means that class A2, for example, you do not recommend using
It
this
can be
kind of
used.
cabinets.
Of course, it
Type
can be
2
used.
A2.
Type A2 can be used for hazardous drug preparation, but I prefer type B2.
Okay. Okay. Thank you very much.
Thank you.